Okay, I want to welcome everyone once again to Living Well. Thanks for all those who are joining us this afternoon. We welcome you again. As our presentation every Saturday at 4:30, we have this presentation. And before we start, I just want to say this disclaimer that this presentation is for educational purposes only, and information that we share is usually from research, personal experience, and biblical scriptures. Our goal is to educate our audience on the topics that we are discussing week after week. If you have any specific condition or situation in which you are concerned, you're encouraged to seek advice from your personal physician. As I said, this is for educational purposes only, and it is for you to increase your awareness on the topic presented. Okay, we are going to be talking about the digestive process. This is a very big topic. So we have divided into two, or maybe we might have to do even more added presentation to this topic because it is so vast. So we're going to be talking today about the digestive process from chewing and how the food moves through the body. Today, I will be talking with Josephine, our dietitian, our registered dietitian. She will be discussing the process of digestion. Gut health is very important. A couple of weeks ago, we started this discussion on gut health, and we saw that it was very informative and a lot of people had questions about it. So we decided that we're going to continue. So Josephine will be going a bit deeper with the digestive process, where it all begins. This discussion will be divided into two parts, as I said, because the amount of information involving this subject, the digestive process, is vast. The digestive process is the key to gut health. If food is not digested properly, gut health will not thrive. Gut health begins with the physical state and the physiological function of the various parts of the digestive system. Think of our gut like the control center of all the operating system in our bodies. If this system does not work properly, it can put the whole body into a diseased state. So where does it start? Food is processed in the digestive tract. So to understand fully gut health, let's start with digestion. So Josephine, can you explain what is digestion?
Thank you, Emilyn. Digestion is the process of the breaking down of the food that we eat into smaller parts, and then the absorption of those minute nutrients into the body. The digestive system is the highway along which that microscopic nutrient travels, and the cells are the final destination of those nutrients.
Okay, so from what you just said, digestion is the breaking down of food. So if digestion is the breaking down of food, it has to go through a process. So, and there are different organs that are involved in this process. So can you tell us what are the parts of the gastric intestinal tract that are involved in digestion?
Okay, you have your mouth, the esophagus, the stomach, small and large intestines. You have your anus and rectum, and there are also some accessory organs that are involved in the digestive process, which includes, but not limited to, your liver, your pancreas, and your gallbladder.
Okay. Okay. So, if you see this picture that I have up, it takes you through the different areas of the digestive tract. And each one of these areas have to be functioning at an optimal level in order for this system to work properly. For this GI tract, we call it sometimes gastric intestinal tract, to work properly so that we can absorb a food, so we can have the nutrients that we need to keep our bodies healthy. So you started off saying, Josephine, that the mouth is part of the digestive tract. So what goes on in the mouth with the digestive process?
Okay, I want to say before I go to the mouth that we think that the smelling and the seeing and the thought about food has a part to play in the digestive process, because when we smell and we see the food, think about it, our mouths begin to water, right? I'm sure
Right.
we can agree with that. But in the mouth, which is the oral cavity, you have your teeth and your tongue, you have the salivary juices. And the salivary juices come from 3 different pairs of salivary glands. One is the parotid gland, which is up by the temple. And you have the sublingual gland, which is under the tongue, and the submandibular gland, which is across by your jawbone. So these are areas where the juices come from. And it is believed that the gastric juices also start to flow when the salivary juices start to flow as well. So we put the food in our mouth and we have the tongue and the teeth working the food in our mouth. So that's the teeth, we call it the mechanical breakdown of the food in our mouth. The saliva lubricates the food as we chew. And it also helps to shape the food along with the tongue. In our saliva, we have some enzymes. One is called amylase, salivary amylase, that start the chemical breakdown of our carbohydrates. We also have salivary lipase, which also starts to work on the fat in our mouth. So now it's a lingual lipase, sorry. These enzymes start the chemical breakdown of the food, those 2 foods, while our teeth does the mechanical work on the food, breaking down our food into smaller pieces. Now, go ahead.
Okay, so I am understanding you emphasizing smaller pieces. So I am getting to understand that in order for food to start the digestive process, it must be broken down into smaller pieces.
Yes.
Therefore, chewing is very important.
That's right. Chewing, or we can say mastication, that's another name for it. Chewing, it has 3 main functions. Chewing helps to reduce the particle size of the food for easier digestion. So when you eat, it's good to put small amounts in your mouth. Take your time and chew. It also helps to expel air and mix food thoroughly with saliva to form what we call a bolus. Chewing also helps to increase the surface area of the food, because when you chew, the food breaks up and the surface area becomes more to allow more digestive enzymes to have it to make the attack to break down the food molecules. So it also makes the food better available for absorption. And when you chew your food properly, it's an effective way to control your portion size, and it prevents overeating. So chewing is very important to our food. So when we don't chew properly, it can cause the rest of the digestive system to become confused, because they're expecting a certain quality of the bolus to come down, and then maybe this big chunk of foods come down. And the enzymes may not know what to do with it, because they cannot find any way to attach themselves to it, because it's not chewed properly. So take your time to your food, get the surface area for the enzymes to attach, and chewing also helps to put less stress on the stomach and other digestive stuffs.
Mhm. Wonderful. So chewing must take place before food can be digested. There was one author, Horace Fletcher stated, "Nature will castigate those who do not masticate." So if you do not chew your food properly, know that you are in for problems.
Yeah.
I know some people say you must chew your food for 32 times. I don't know where that came from, but 32 times. I think I read somewhere where it says because of 32 teeth, they'll chew for each one. But anyhow, you must chew your food so that it is, soft and mushy in your mouth, where when you swallow it, it does not go into big chunks, as Josephine is saying, because that will prevent digestion from taking place. So I heard you talk about saliva, from in the mouth. That's where the food start breaking down from the saliva, the amylase and so forth, these different enzymes that we have in our mouth. So I've heard people say sometimes, "Oh, I have a dry mouth." How can someone, fix this problem? Or are there problems that can develop in the mouth to hinder the production of these various gastric juices or that start?
Yeah, there are some. I'll just say some. I guess there could be more, but the medical terminology for that is xerostomia. That's the dry mouth. And certain medications can cause that, like some hypertensive medication, antidiuretics, antidepressants. So it's good when you're taking these things to check the different side effects, because sometimes medication have numerous side effects. So medication can do that. If someone is getting radiation therapy, especially for head and neck cancer or chemo drugs, that can also cause dry mouth. If you're dehydrated, or if you're in the night, if you're not feeling well, you might have a stuffy nose and you start to breathe through your mouth. Your mouth can become dry. Some persons with diabetes, or if you have a stroke or Alzheimer's, you can end up with dry mouth. So how do you know you have this dry mouth? Some people may have bad breath or constant sore throat, sores and pain in the mouth, or hoarseness, or you can feel your mouth being dry successively. So the elderly, some elderly persons are at risk for developing this condition, because as we get older, we don't produce as much saliva as we used to. And when this happens, it diminishes the case, it diminishes hunger. So the elderly may not feel hungry because of this dry mouth. So we can go and see if we can get this condition sorted out by first managing underlying conditions, because some of them can be managed. And at home, I know they say they have artificial saliva, but I don't know much about that. But I heard about it. They have artificial saliva. But in your house, you can use the kimchi, which is a spicy fermented cabbage-like food, the sauerkraut, garlic, and ginger. They also say you can chew some sugarless gum that contains xylitol, or suck on a sugar-free candy. You can drink plenty of water. That will help the dehydration. And in the night, if it's a problem with your breathing, you can use a humidifier and you breathe through your nose. So those are some things, and I'm sure that there are many more, but those are some things you can do in that regard.
All right. Yes, I have also heard about using like lemon, sour things, where you either can think about it, you can just cut them up and have them in front of you. Just the sight of those sour, like a lemon, something. Yes, you start salivating. You start producing these juices, these the salivary enzymes. So if you have this problem, that's another simple way that you can fix this problem by, you know, cutting up some lemons or something and have it there, and you're gonna start, you know, salivating, start producing saliva, because it is so important for you to have that saliva in your mouth where you can chew and get that food softened and break down in order to digest it. You know, we think it is so simple, but this simple process can cause harm in the future, because we are not going to be able to digest the food properly if it does not start in the mouth to digest and to break down properly. It will cause a problem. So that's why we emphasizing this so much. Make sure before you swallow your food, it is properly chewed, softened, and broken down. It is best if you're in a hurry not to eat. Don't even bother about eating. You need to find a time when you have the time to eat, at least a 15 or 20 minutes period where you can sit down with your food and take your time and eat. Eating on the go, eating in a rush is not going to help digest the food, and we are going to have problems with our GI tract. We're going to have problems maintaining a healthy gut. If we do not have a healthy gut, it brings sickness on ourselves. So please take these admonitions that we're giving you to heart, because they're very, very important. So Josephine, I guess you started with the mouth. You said is the first part of our digestive tract. And then as the food goes down, you talk about the esophagus. this long tube that connects the throat to the stomach.
We didn't talk about,
Pardon me?
we didn't talk about the esophagus yet.
Okay, so yeah, so I was going to tell you now, can you explain some more, elaborate some more what goes on with the esophagus and the importance of taking care of the esophagus?
Okay, so the food in our mouth now is called a bolus, and the tongue pushes it back to the back of the throat, where it will encounter something called the epiglottis. That's the area of the oropharynx close to our trachea or windpipe. So this epiglottis, it's a little flap that covers the entrance to the windpipe. And if that doesn't happen, the food will go in the wrong direction. Instead of going to the esophagus, it will go in the windpipe. And you know, when that happens, when the food, we like to say the food gone down the wrong throat, but we will start to cough. So this esophagus is about 8 inches long. It runs behind the windpipe and the heart and in front of the spine and passes through the diaphragm. So the esophagus, the bolus moves down the esophagus with a rhythmic way. I'm sure when you eat, sometimes you can feel the food sliding down your esophagus. It takes about 6 seconds to go down. We call this movement, this wave-like movement, peristalsis. So note next time you eat how it feels. It's like a squeezing down action along the esophagus. And there's a major mucus released to help lubricate the travel. So sometimes when you don't take your time and chew and you swallow it or you eat something that's very dry, you may have to drink a little fluid to help to moisten it so it can go down. Sometimes it takes a while. So get your saliva flowing, chew your food well into the small parts so that it can go down the esophagus without any problem. Esophagus is a group of muscles that are there, and they play a very important part. So I don't know if, Emily, you want to talk about that? You can ask me the question.
Right. So the esophagus, you said that long tube that goes down, connect to the stomach, and the food moves with this peristalsis motion, and it enters into the stomach. Now, as it gets into the stomach, I understand there is a ring that separates the stomach from the esophagus, called the esophageal sphincter. Now, how important is this esophageal sphincter that divides the stomach from the esophagus? What role does that play with, with digestion?
Yeah, so the lower esophageal sphincter, or the shorthand say the LES, is where the stomach is attached to the esophagus. And the bundle of muscles at the end of the esophagus, where it means the stomach. It is supposed to remain closed until the appropriate time. When it is closed, it prevents acid and stomach contents from traveling backwards from the stomach. If it is not completely closed, then acid and stomach contents can flow back from the stomach into the esophagus, resulting in some very serious issues that we have these days. We have heartburn, and some people say that they cough and they get gastroesophageal reflux disease. And there are things that we eat or drink that can cause this tight set of muscles to become slack and relaxed. Certain medications like antibiotics can cause that. Pain medication, antidepressants, the same radiation therapy, exposure to secondhand smoke, obesity, pregnancy, lots of things can cause it to get slack and relax and cause the backflow of food into your esophagus.
Okay, so from what I'm understanding, is that these groups of muscle that's separating the stomach from the esophagus must stay closed. The only time it opens up is when the food is entering from this esophagus, that long tube, into the stomach. After the food gets into the stomach, it must remain closed, or else we will have problems. That is why some people have this burning in their stomach after eating, or sometimes not even after eating. It could be hours after they start with this burning in their stomach, because that muscle is not tightened enough, and it causes the food to backflow into the esophagus. So as Josephine was saying, that there are certain problems that can cause this. So if you know you're taking antibiotics, usually antibiotics is not forever, but someone who is pregnant, that could, or that could be for a period of time. They need to take steps in preventing or controlling that burning, because after a while, that burning, because it's acid, and it does not belong in the esophagus, and it can erode the esophagus and cause ulcers in that area of the esophagus, and bleeding and so forth. So therefore, we have to protect that by chewing our food properly. Again, it starts from the mouth, chewing and going into the esophagus, going into the stomach, so that those gastric juices in the stomach can do its job. So now the next phase, now we are from the esophagus, now the food has entered into the stomach. Can you elaborate what goes on in the stomach to help digest and to help make, turn this food into nutrient for us?
Okay. On reaching the stomach, the food passes through the LES, and the stomach is a highly acidic place, very acid, and this is for a purpose. This acid helps to destroy any bacteria or parasites that may have entered the body with the food. Isn't that nice? So the stomach, the food is there, and then the gastric juices come into play. Gastric juices are sent into the stomach by something we call the parietal cells. And the stomach, those gastric juices, those acidic gastric juices have a role to play in digestion also. They help to break down the protein into peptides and also continue the carbohydrate breakdown. The gastric juices also help to get the B12 from the animal protein that we eat, and it has to initiate something called intrinsic factor, which is the carrier for B12. So the carbohydrates are further broken down, so are the proteins. And without that gastric juice, digestion would not be successful. So can we have too much or too little gastric juice? Hmm?
Yes, so, you know, that's a question that I often wonder, why some people have problems with gastric ulcers or even acid reflux. I go back to that. Why does that happen? Why?
It used to be thought that, as we say, heartburn was caused by too much acid in the stomach. However, we now know that heartburn is most often caused by too little acid, too little acid in the stomach. Either the food has been sitting in the stomach for too long because there's not enough acid to properly break it down, or the esophageal valve is not functioning properly and fails to keep the contents of the stomach from rising up into the esophagus. So sometimes it could be the case of too much acid, and sometimes it could be the case of too little acid, but most often than not, it's a case for too little acid. And what happens is that when we go to the doctor, they give us antacids. I'm not sure if they test to see if you have acid, but sometimes it makes matters worse. So you have to test, not guess. Doctors, health professionals have to test and not guess. And one size does not fit all. Not because somebody came to you with the same complaint and you gave them whatever and it worked, it's going to work for the other person. You have to know each person individually and test for stomach acid and not just guess.
You know, in America, they said that I think I read somewhere, over 70 million Americans take anti-acid medication. And this is a big problem because a lot of them, and it doesn't work, and they constantly keep taking it. And that could be because, as you were just saying, Josephine, is that sometimes the treatment for what the doctor maybe diagnose you as is not the proper treatment. So the acid in our stomach, it's so potent that if we get that if that acid from our stomach, if we can collect it and drop it on the concrete, it will bore a hole in the concrete. As a matter of fact, I think I read the stomach, the pH of a normal stomach is between 1.5 to 3. And for proper digestion to take place, that pH needs to be between 1.5 to 2.5. That is how acid it is and needs to be. And when we take antacids, it contradicts this whole process. That's why we have so much problems with gut health in this country and throughout the world, because people are taking too much antacid. As a matter of fact, if you read on the box or the package of those antacids, it tells you to take it only for 7 days. No more than 7 days. And for the whole year, I think it says 42 times, something like that. But what happens? We take antacid day after day after day after day, and we think we are helping the situation, but we are not. So we have to be careful. And it all starts, again, I go back to the mouth, not chewing the food properly, chewing the food too quickly, big chunks of food gets into the stomach. The stomach cannot digest it, as Josephine was saying. because the enzyme cannot hold on to those big chunks and further digest the food. So therefore, the food sits in the stomach. And when food sits in the stomach for too long, it putrefies. It starts spoiling, rotting. And then, yes, and then that causes that esophageal sphincter that we talk about, that causes so much pressure now in the stomach that it opens up. That sphincter open up. And that's why acid now from the stomach goes back up into the esophagus and cause that burning of food. So Josephine, what are some of the gastric acids that takes place in the stomach to help further digest foods, our food?
Will you please repeat that?
I said, what gastric acids that's in the stomach, or to help further digest the food. So now the food is in the stomach. How is the food further digest?
We have the hydrochloric acid. Our stomach makes about 1 liter or more of gastric acid every day. And that is for the purpose to help digestion. We have the acid and we have the enzyme, we have the pepsin that further breaks down the protein, which are now peptides, into amino acids. And we have the amylase that further breaks down the carbohydrates. We also have the B12 and we have iron and all of those things there, which are part of the digestive process. So if your stomach is low on hydrochloric acid, these things cannot function. And it will be a place to have a bacteria like the H. pylori, because no stomach acid is there to help to kill that. So there's a test we can do at home to see if we have this stomach acid, see what the problem is. We can use 8 to 10 ounces of water with a teaspoon of baking soda, and as first thing in the morning on an empty stomach. You can do that and then wait for 50 minutes. And if you burp, or we say belch, that means you have stomach acid. If not, you'll have to go a step further and they have something called the gold standard to test for stomach acid, the Heidelberg stomach acid test, but it's costly. And they have other things you can do to see if what's going on in your stomach.
Mm-hmm. Okay, so hydrochloric acid. Hydrochloric acid is in the stomach there waiting to further break down the food. I've heard people say that when they have heartburn, they take apple cider vinegar to help with the burning, and it works. So why does that work? Why would taking more acid on acid when you have all this acid in your stomach? Why does that work?
Because they cancel out each other.
Okay, so because the food in the stomach, I guess, was not acid enough, and by taking the what you call it, the apple cider vinegar brings more acidity into the stomach and makes it work. Yeah. So should you take baking soda? I've heard people about baking soda. Baking soda to help with their stomach problems.
Because all of these things are acidic. So that will help with the digestion as well.
Mm-hmm. Okay, so are there any natural remedies if you have problems with your stomach because of too little of acid in your stomach? Are there natural remedies that we can do to help increase this acidity in our stomach?
In the case if you have your heartburn, as we call it, we can do some natural probiotics. You can do supplemental probiotics. The apple cider vinegar, a tablespoon in 6 to 10 ounces of water. You can use aloe vera juice, 2 to 4 ounces of aloe vera juice. Fennel tea. We have the slippery elm or marshmallow root to help soothe the stomach and your esophagus. And I guess there are more, but those are some I know that can help with that.
Okay, that's very good, very good. I remember one time my brother was here visiting me, and after eating, he developed heartburn, and he wasn't feeling good. And I remember I took a piece of ginger, crushed it, and boiled some water and let it seep for a while. And after he drank that, you know, he didn't even realize that the burning and the upset stomach was gone. While he was talking to me, he said, but wait, my stomach feels better. You know, so ginger, lemon and ginger is also a good, a good remedy for, natural remedy for acid, too much acid in the stomach, or to help neutralize that acid so it doesn't cause that burning in the esophagus.
Also you can eat fermented vegetables, and you can do kefir and tempeh and miso and kombucha and the kimchi and the sauerkraut and probiotic yogurt. And chew your food properly, limit processed foods.
Wow, wow. So again, we go back, chewing the food properly, very important. Chew your food so that when the food gets to the stomach, the enzymes can latch on to the food and help digest that food so it can take it further down into the duodenum and the ileum. Now, we will not go in further than the stomach today, because if we pass that, there's so much different action and reaction that goes on further down in the stomach that, you know, time does not afford us right now to discuss that. But I want for everyone to take away from what we just discussed here, that I go back again, the importance of chewing, the importance of, you know, sitting with your food, taking your time, do not rush through eating, and chew your food properly so that when you swallow that food, it goes into the esophagus without any problem and into your stomach where it can digest properly. Do not, you know, when you, after eating, or sometimes you might feel a discomfort in your stomach. If you have anything tight around your waist, you need to loosen it, because that tight belt or skirt or what have you can cause that esophageal sphincter to open up and have you experiencing that acid reflux symptoms. So when you have to eat, make sure your clothes is loose so it doesn't form that tight feeling in your stomach around your waist. And also sit up and eat. Do not eat lying down, because the food, you know, gravity is important. So the food can get into your stomach and not regurgitating. Do not try not to eat and drink at the same time, because that can decrease the acidity in the stomach and cause delay in digestion of your food. So those are some things that we want you to take away. Avoid antacids. Antacids are not healthy for the gut environment because we need that pH in the stomach to be at least 1.5 to 2.5 pH. If it is less than that, food will not digest. As a matter of fact, the food sits there in your stomach until it gets to a pH of 1.5 to 2.5 for the other enzymes that we need from the pancreas and the bile and all of that to come to take place to further digest our food. Because if our pH is not at optimum level, our food will not get digested properly. So we must keep that healthy pH in our stomach. Taking antacids will not help. Sometimes you might have to take them, but I encourage you, do not take them forever. They are not to be taken forever. Read the package and you will see on that package it said only take for 7 days. And if your doctor is encouraging you to take this forever, you need to have a discussion with him. Fine, with them, I should say, I'm male or female. Have a discussion with the doctor and find out what are the remedies you can do for this problem. And I'm sure maybe if you start chewing your food properly and following these steps that we give you, maybe that problem will go away and you will not need the drugs that they're promoting. So right now, we are going to open up for questions. If anyone have any question, before I do that, I'm not sure if Josephine have something else that she wants to say before we open up for questions. Josephine, is there anything you want to say?
Well, it's just that depends on what you're eating. It should take you, a full meal should take about 20 minutes to finish. 20 minutes.
Okay, so you need to set aside at least 20 minutes of your time for eating, where you have nothing else in your mind but your food in front of you and looking at your food and enjoying it. You cannot be thinking about, oh, I have to go, wash these clothes, or I have this errand to run. I have, things to do, after I finish eat. Because that your mind is a powerful thing. So when you start thinking about other things like that, it slows down your digestion. So you must have 20 minutes of clear, nothing, coming into your head where you have to be rushing to go to do next. You need to sit and eat, have that 20 minutes period where you can eat your food.
Alicia has a question.
Okay. I'm not seeing the chat. Any question in the chat? Let me see.
Alicia has a question. Her hand is up.
No, I had my hand up. I was not really a question, but I had a problem similar to that some years ago, where I would the food, when I lie down to sleep, the food will literally come back up through my nose and my mouth. And as I sit here now, I can swear by apple cider vinegar. I went to the doctor and they gave me the antacid to buy, and I bought it. I bought about 3 bottles, and I can't remember who told me about the apple cider vinegar. I came and I did my own research, and I started using it. And I would put a tablespoon in 8 ounces of warm water. To me, when you put it in the warm water, it's easier to drink because you're drinking it like tea. And I would do that on an empty stomach every morning. And that apple cider vinegar healed that stomach that I had was giving problems. It's something I try not to to be without in my house.
Mhm.
It is very good. People just say all kinds of things about it, or it's bad and you're too much of it, but you have to know how to use it. If you know that thing going do you bad in one way, you don't drink it constantly. And them antacid and them thing don't work. They don't work. They don't ever work. Because I could remember end up throwing away the bottles after having them there for more than a year, 2 years. Just sit down there without 2 of them, the seal not even broken. So, and one other thing I was going to talk about too, eating and drinking, but I heard you mention it. Eating and drinking is a thing that's caused it to have bad stomach as well too.
Mhm.
You can't eat and drink at the same time.
Mhm. Mhm. Yep.
Because
Thanks.
that food will stay there and rotten. That liquid has to digest first before that food come and die. And by the time that happens now, the food start to ferment and so on and start to spoil in the stomach.
Yeah. Thank you, Alicia, for sharing that experience. And as you can tell, the reason why you were having that acid reflux was because you did not have enough, your pH was not low enough in your stomach to digest the food. And it will sit there for hours. And as I said, until that pH gets to the right level, the food does not digest. It sits there, putrefied, and that can cause, you really had some severe acid reflux when it's coming all the way up to your mouth and to your nose. Wow.
I used to have to put my head on, I used to have to put my head high up in the night when I'm sleeping. And sometimes it would come through before I catch myself, and I would fly up off the bed and just sit and relax myself until I kind of catch myself. But I used to always have to put my head up high, and no, I don't have to do that.
Wonderful.
Praise and
Yeah.
thanks to God.
Right. And you know, what could have happened too while you're sleeping, because you're not aware of what's going on, when that food, that reflux takes place, that food comes back up, you know, the esophagus, you remember, as Josephine said, it passes next to the pharynx, to the lungs. So that food can go into the lungs. I have had where patients come into the hospital with pneumonia. And one of the reasons is because food got into their lungs because of acid reflux, sleeping, not realizing what's going on, and it backs up, and it's, you know, particles of food getting to their, what they call it, the lungs, and end up causing them to have pneumonia. So it's so very important not to eat and then go to sleep. Because if you're sleeping, you know, laying in the bed, your head is low, that food can regurgitate and gets, you know, into your lungs.
One more thing, the time span that you eat. I believe we are supposed to have a window between your last meal and your bedtime.
For 3 hours.
Although we try, I mean, I don't know how to put it, but you're supposed to have a long window between your last meal and your bed time, the time that you go to sleep.
Right, yes, that's definitely true. We cannot eat and go to sleep. I think maybe sometimes a good 4 hours before going to bed, you need to have your last meal. Wonderful, thank you, Alicia. Anyone else have any questions?
Carol?
Yes.
Yes, Moya here. What I have is a tip reminder that you would have shared with me maybe about 5 years ago. We were eating at the table at my house, and you were sharing with me that when that for good digestion, and I think it was a way to make sure that you chew your food properly. You told me when I take 1 spoon of fork or whatever of food, rest down my spoon and chew before I picked it up, because having it in my hand, you always tend, the food is not really done yet, and you take up another spoon. And I have shared that with so many people. I mean, it's hard sometimes to practice, but I think for good digestion and to make sure that your food is salivating, it's good to put down that spoon. And I
Yeah,
remember that tip that you gave me.
that is so true. Because what happened, once you have that fork or spoon in your hand, you tend to just, not even thinking, you tend to
Yes,
just go right back and take up another scoop and put it in your mouth. So with you putting that down, it allows you to chew the food, and then
yes.
you have to actually think and make a movement and action to pick that spoon or fork up.
Oh,
So
yeah.
that's a good practice that I try to practice all the time. I take a spoonful, I put my spoon or fork down, and I chew and then swallow before I pick up that spoon or fork. And that helps. Because I had
Amen.
acid reflux and all of that one time, where I, not realizing I was taking antacid and did not realize it was doing more harm than good.
Oh,
Yes. So this, this is so very important for us to start with chewing our food properly so that we can end up with good, healthy gut, because that's where it starts. It starts in the mouth, chewing, and then that process continue and food continue to digest as we go down through the stomach. So next time we have a discussion on the digestive process, we will be following up with what happens when food moves from the stomach into these different areas, the duodenum, well, it first goes to the duodenum, the ileum, and then into the small and large intestine. So
Chris,
yes,
is there such a term as or something called tract gas?
top gas,
Tract.
oh,
or trap,
Yeah,
trap
gas.
gas.
Yeah.
That is when you're trying to burp and you just cannot burp, you cannot bring it. Yeah. Maybe that's what I understand it, you mean. I do not know what trap gas mean, but I would just imagine maybe you're talking about when someone tried to burp and they just cannot burp.
either way.
Yeah, I am not sure about that phenomenon, but I can look it up, and next time we can, get some insight on it.
Yeah.
Yeah. So thank you, ladies and gentlemen, for participating. Why is this not moving? For next week, I was trying to get to my next slide, it's not going. I don't know why it's not moving, but next week, our topic will be in regards to women's health, breast health, I should say, and that will be presented by Dr. Sinclair. So if you have friends, family members, bring them on so that they can hear about breast health. And it's going to be very fascinating, because this Dr. Sinclair is a surgeon, and she has seen and done a lot of surgeries and procedures on this topic. So come next week, prepare with questions so that they can be answered. At this time, we are going to go into prayer. Okay, there it goes. Anyone have any prayer requests? No prayer requests. Okay, so I just want to encourage everyone to stay faithful.
Yes.
Do your best in taking care of your body, because our
Mhm.
bodies are the temple of God. And this is why we do this every week, to share how we can take care of this temple that God gave us so that we can stay in optimal health. At this time, we're going to pray before we dismiss. Heavenly
Amen.
Father, we thank you for this opportunity that you have given us, where we can learn about this fascinating body that you have loaned to us. Help us that we will take care of our bodies the way you want us to take care of it. Help us that the lessons that we were taught today about chewing our food and carefully, and the importance of eating the right foods. Help us that we will take these messages to heart so that we can live a healthy, productive life for you. Be with our families and our friends, keep them all safe, and bring us back next week where we can learn more about breast health. Thank you for hearing our prayers. In Jesus' name, amen.
Amen.
Okay, so
Amen.
next week, breast health. Okay,
Amen. Good
okay,
subject.
yes. It's breast month next week,
Yeah.
this month, yes.
We'll try to see how much of our women we can bring on, Carol.
Yes,
Alicia, we'll work on that.
yes, yes,
Yeah, them women, they know what, they know the good things that people have.
No,
oh,
we
where is,
can invite them.
where's
They know what's
mine?
wrong with them. But we will work on it.
Yes, yes, yes.
Emily,
Mm.
stop the recording.
Oh,
No, 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 I want to stop yeah, that's what I'm trying to do, stop recording. Oh my goodness. That's what. Stop recording, yes.